10 early warning signs that your liver isn't detoxifying properly. Yes, if you think the liver's main job is just detoxification, you're greatly mistaken. Symptoms like itching, like diarrhea for example, can all be related to the liver, and we have a huge problem. The liver suffers in silence. This means that many people don't even know they're experiencing liver symptoms. And this video is about recognizing those early warning signs, learning what symptoms, what silent signals the liver is sending us, and that we might even be able to identify a truly life-threatening condition through this knowledge. Welcome to this video presentation. I am Dr. Ulrich Selz, a dedicated physician with my own practice, and I have a long-standing focus on liver health. Why is that? It's because my medical background is rooted in emergency medicine, anesthesia, and the operating room environment, where we frequently encounter poisonings as part of emergency care. Additionally, for our own safety, since we handle toxic anesthetic gases, we must be well versed in the subject of poisoning. Now let's delve into the functions and duties of the liver. The liver boasts an extraordinarily high rate of blood flow. For this presentation, I crunched the numbers. It processes an amount equivalent to 246 cases of beer every single day. That's the volume of daily blood flow it handles, and in essence, the liver functions as a highly efficient blood cleansing apparatus. To comprehend the linkage between early warning signs and liver health, it's crucial to understand that liver diseases can be grouped into three types, or more informally, we can categorize liver function into three non-technical classifications. Initially, we'll discuss issues that occur above the liver. But why is that? A liver congestion is essentially a backup from the right heart. The right heart pumps the blood into the lungs. We'll take a closer look at this in detail shortly. Then the second category, alongside liver congestion, involves structural changes in the liver. If we think about liver cirrhosis or poor detoxification, a fatty liver, or simply elevated liver enzymes, then all these conditions indicate that there has been a structural change, that the liver cell is no longer intact, that it's breaking down. That's why the liver enzyme levels also rise. Elevated liver values essentially mean that the cell has been damaged and that these enzymes which are inside the cell are then released into the blood where we can measure them. Or, as previously mentioned, we're dealing with a detoxification issue. And this detoxification problem is something that over time affects the entire body. The detoxification issue leads to other tissues eventually breaking down. Yes, the liver is involved in 500 to 600 different metabolic processes, and we could hardly survive a second without it. Why? We always think of the liver in terms of toxins that come from outside, like cigarettes and alcohol or something like that. But in reality, the liver's biggest job is to detoxify the toxins that are produced inside us. But that's not all. The liver has numerous other functions and is primarily our energy storage. So, what exactly does this imply? The liver has the capacity to store substantial quantities of sugar in the form of a substance known as glycogen, and it has the ability to release this sugar into the bloodstream whenever the body requires it. This process is particularly evident during endurance activities, such as a marathon where the body's glycogen stores are depleted, akin to a battery draining its charge. Moreover, the liver plays a crucial role in ensuring that the brain receives a steady supply of energy. However, the liver's functions extend far beyond this. It is also instrumental in generating ketone bodies when the body metabolizes fat. This is not limited to glucose metabolism. The liver is exceptionally adept at managing fat metabolism as well. This has implications for individuals who suffer from headaches and whose brains have adapted to predominantly utilize fat for energy, preferring fat oxidation over glucose oxidation. In these scenarios, the liver's contribution is extremely significant. Additionally, the liver is responsible for producing factors that aid in blood clotting. So, the liver produces various proteins, and two of these proteins are called albumin, for example, and globulin or globulins. And these proteins are involved in ensuring that when we have an injury, for instance, or suffer from something more severe like a heart attack or, well, anything, a blocked blood vessel, the liver is responsible for producing these clotting factors. And that's a particularly critical issue in the intensive care unit. When we see a patient with liver issues, ultimately we also see. At some point, a clotting factor issue arises. We must administer these factors and give blood transfusions, otherwise the patient could bleed internally. It's a very dangerous and extremely difficult condition to treat. condition, especially for the patient. And then the immune system is also one of the liver's main functions. Why? The liver has the task of producing additional proteins, which in this case are called immunoglobulins or antibodies, something everyone has heard of before. So here in the production of proteins, not just for the blood, the clotting factors, but also for the immune system, the liver plays a very, very significant role. Indeed, the term cholesterol is well known to many. The liver plays a crucial role in the synthesis of cholesterol, actively participating in its production. When there is an overabundance of cholesterol in the body, the liver works in conjunction with an organ situated just beneath it, the gallbladder. Structurally, the liver is made up of numerous small lobules, which are comparable to the functional units found within the kidney. One of the primary functions of the liver is to produce bile, a substance that is subsequently stored in the gallbladder until needed. And when we have too high a cholesterol level, that's when the typical gallstones form, which are usually what we call cholesterol stones. The funny thing is that cholesterol is actually used in the liver to produce hormones. So the liver not only produces hormones, it also breaks them down, activates them, and as you've already seen with one hormone or prohormone, which is vitamin D, the liver is deeply involved in activating this very important vitamin D. With liver diseases, unfortunately, we always end up with the same outcome, the destruction of liver cells. The early warning signs we're about to discuss are meant to protect us from these diseases. They are intended to function as an early warning system, and I want to succinctly outline 3 prevalent liver diseases to illustrate the connection between early warning signs and liver conditions. Let's take fatty liver disease as an example. What exactly is a fatty liver? It's a condition where there is an excessive accumulation of fat cells within the liver. As a result, the liver slightly increases in size and becomes infiltrated with fat cells, typically due to metabolic problems associated with glucose metabolism. This can result in substantial fat cell accumulations, particularly in cases of insulin resistance or diabetes. If not addressed, this can cause the liver to become greatly enlarged and may eventually progress to a state known as liver fibrosis. This means the liver becomes infiltrated with connective tissue fibers, and that's a very, very, very bad condition. Another condition is liver inflammation. Chronic hepatitis, for example, caused by viruses. Here, there's simply a real inflammation of the liver, and there are hepatitis conditions that go smoothly, like hepatitis A, the traveler's hepatitis. There, you get a short-term inflammation of the liver. The inflammation then subsides, and we don't have any lasting damage to expect, or usually no long-term damage to expect. And then there's hepatitis B, a different virus that can damage the liver over a longer period, and it can ultimately lead to disturbances in the liver cell. And the third, the condition I want to mention in this context is cirrhosis of the liver. Of course, everyone is familiar with that. Cirrhosis of the liver is associated with excessive alcohol consumption, but can also be related to toxins or something of that nature. And here, you really get a very, very severe fibrous overgrowth of the liver, and that obviously causes very strong symptoms. The liver can no longer perform its function. Eventually, it leads to liver failure and an extreme exacerbation of the symptoms, which we will discuss now. Yes, the first early warning sign is what's known as xanthelasma. And what is xanthelasma? Xanthelasma are small bumps, plaques, about 0.5 millimeter to 1 millimeter in size. That's how they first appear. Or perhaps just as a change in the skin, specifically here in the subcutaneous connective tissue, or also located in the region of the upper eyelid. Xanthelasmas are frequently observed as cholesterol deposits build up in that area. These deposits can be a sign of various issues such as consuming an excess of fatty foods, disruptions in the body's cholesterol metabolism, difficulties with the breakdown of cholesterol, a deficiency in bile production, or even complications arising from poor gut flora, which hinders bile from being properly excreted. When faced with such challenges, the body must find alternative pathways to eliminate excess cholesterol. 2 common outcomes are the formation of gallstones and the development of xanthelasmas. For those suffering from xanthelasmas, attempting to prick or squeeze them out is futile. Laser treatment might be the most effective remedy. It is highly advisable to incorporate bitters into your diet, cut out sugar, and adhere to a ketogenic diet as potential strategies for managing this condition. Ultimately, this serves as a preliminary warning or an alarm indicating that there could be a problem present. It could be a case of fatty liver, or a fatty liver might be in the process of developing. In this scenario, a ketogenic diet could be beneficial by effectively lowering blood sugar levels, reducing cholesterol, and ultimately counteracting the condition with a vegetarian or vegan diet rich in whole grains. The second symptom, which a great number of people experience to a mild extent, though here it is certainly overstated, is the condition known as jaundice or icterus. In patients with a severe liver disease, patients are completely yellow, so it's very noticeable. But there are also often mild changes, yellowing of the whites of the eyes, and that's an early warning sign. Of course, it could also be Gilbert syndrome, that's the name of this condition. It's simply a harmless genetic peculiarity or a very common genetic trait in the breakdown of bilirubin, which is ultimately the breakdown of blood components. But jaundice can also occur with liver disease. So it's about the red blood cells being broken down, recycled, and one of the end products is called bilirubin. And this bilirubin is normally excreted with the bile. It also impacts the brown coloration of the stool. We'll discuss what it signifies when the stool is no longer brown. This bilirubin must be eliminated from the body, and if there are problems and it can't be excreted, then unfortunately it's broken down in the skin, and we can see it very clearly beneath the eye. One of the symptoms you'd probably least associate with liver problems is hemorrhoids. Of course, there are many other causes for hemorrhoids, but there's often a connection where there can be congestion below the liver. So let's say we have a drainage problem in the liver, and into the liver there's this really thick, hefty vein that goes in, the so-called portal vein, which collects all the blood from the abdominal area. And if there's a backup here into the venous system, then problems, expansions can occur at two places. These are the varicose veins, the spider veins, and varicose veins, or even the varicose veins in the anal area, which are the hemorrhoids. And we often see this same mechanism ultimately in pregnant women who suddenly develop hemorrhoids because the big belly is pressing down on the portal vein. But it can also be that it's due to a liver congestion, which then, just like on the highway, simply creates a backup. So pay a bit of attention here as well. Another issue that we encounter is referred to as steatorrhea. You might be wondering, what exactly is steatorrhea? I have illustrated it here as resembling a pale grey sausage, or have provided a photograph to show you, and that is a fairly accurate representation of its appearance within the body. When you notice that your stool is discolored, lacking its normal pigment, or when it presents as light grey, beige, or almost whitish in color, these are the characteristic signs of steatorrhea. This condition typically originates from a malfunction in the production of bile acids by the liver. If there is a complication, such as bilirubin not being properly excreted, a problem we've touched upon earlier in this video while discussing clotting disorders, then this results in the stool losing its normal coloration. Consequently, digestion is compromised, potentially leading to further issues like diarrhea, among others. Therefore, the presence of an ochre-colored stool is a definitive indicator that there may be an underlying problem with the liver or gallbladder. So, what measures can be taken to address this condition? Of course, one should consider typical measures such as bitter substances for inadequate bile flow, but it's essential, for example, to conduct an ultrasound to eliminate the possibility of gallstones, obstructed bile ducts, or symptoms associated with pain. Thus, a genuinely comprehensive approach is warranted. A real hardcore early warning sign. The next symptom is itching, and it's along the same lines. If the gallbladder isn't doing its job, if the bile, which needs to be further processed, needs to be transformed in the small intestine with the help of gut bacteria, with the help of small intestine bacteria. That's why the gut flora is so important. If this transformation isn't right, then ultimately it can lead to a detoxification blockage, if you will, and then you get itching. Is involved, it stores and concentrates the bile, which includes these toxins. If it can't get rid of that, then roughly speaking, the toxins remain. They linger in the body. It's a crude expression, but it simply leads to an accumulation of toxins, and they can cause itching under the skin, these metabolic products, and they can also Our next symptom turns into cold hands. This is also something that most people can't associate with the liver, but the terminal vascular bed, meaning the capillaries, are really very, very long, 2.5 times around the world to be more precise. The literature varies a bit, but it's about 2.5 times around the world. So that's approximately 62,000 to even 75,000 miles.
1000 Kilometer.
Within our bodies, a network of blood vessels exists, and within this network, the capillaries are exceptionally tiny. Consequently, it's natural for buildups to occur as a result of oxidative processes, difficulties in eliminating toxins, and similar issues, leading to the formation of deposits and essentially cellular debris. Take, for instance, the accumulation of cholesterol. Such deposits can drastically reduce blood flow in the terminal vascular bed, which in turn can lead to problems such as cold hands. This issue is particularly acute in individuals with type 2 diabetes, who may already suffer from vascular damage, thus exacerbating the problem. Indeed, those with type 2 diabetes are at an increased risk of vascular blockages, which can become so severe that the blood circulation in the extremities is so compromised, amputation might become necessary. Moving on, our next symptom to discuss is poor eyesight. How does that manifest? When the liver isn't functioning properly or when the pancreas isn't working, we can't effectively break down or digest food, nor produce the fat-soluble vitamins, so the entire system suffers. The entire metabolism is disrupted. The fat-soluble vitamins are easy to remember: E, D, K, A. That's something you always learn in your studies. And then essentially we can end up with a deficiency, including a deficiency of vitamin A. And here we might have disturbances that can lead to a deterioration of general eyesight. But especially night vision, and if you're night blind or if you notice that you're increasingly struggling to see at night, then this could also be an early warning sign of liver issues, and it would be worth taking a closer look. That's ultimately an early and late warning symptom, and it's called asites. Let me explain. Asites is a specific type of fluid accumulation in the abdomen. The abdomen becomes distended, the abdomen swells. The abdomen appears swollen, but this isn't due to an accumulation of fat. Rather, it feels sloshy, indicating the presence of fluid. This condition is known as asites, characterized by a pronounced distended belly that results from the collection of water. The underlying issue is a disturbance in protein metabolism, specifically involving a protein called albumin, which we have previously discussed. This disruption leads to hypoalbuminemia, meaning there is an insufficient amount of albumin in the body, which in turn triggers osmotic processes that cause severe fluid accumulation within the abdominal cavity. The development of asites can be quite insidious, so it's crucial to monitor for any signs of this condition in yourself or in others, such as a partner. To put it simply, we're looking at a case of an excessively bloated belly, one that is filled with water and could easily be confused with conditions like fatty liver or something of a similar nature. However, it might actually be asites. This condition is frequently encountered in intensive care units where a drainage procedure is performed to remove the fluid. To prevent excessive disruption of the body's fluid balance, the removal is done gradually, extracting only small quantities of fluid at a time. Moving on to a symptom many individuals experience: shoulder pain. This pain can occur in a manner similar to how the pain from a heart attack may radiate to the left arm or back. In this case, pain can emanate from the liver or gallbladder and be felt in the shoulder area. The liver and gallbladder are supplied by the vagus nerve, which is part of the autonomic nervous system, and this autonomic nervous system, or to phrase it differently, the organ itself doesn't cause direct pain or send direct signals of discomfort. However, it's possible to experience referred pain where nerve impulses and fascial discomfort can manifest in the shoulder area. This is particularly true for the right shoulder, aligning with the position of certain organs on the right side of the body. Consequently, this can result in shoulder and neck pain, which might occur, for example, after consuming excessive alcohol or celebrating at a wedding. Thus, there are certain conditions, fascia and certain nerve connections between the gallbladder and the shoulder neck area. There's a lot that's interconnected there. Migraines or headaches are related to this, especially if there's a liver or gallbladder burden. A liver or gallbladder stress primarily it's a congested liver or a bile congestion issue. When that happens, when the bile or the gallbladder is distended, or in other words, when the bile exerts pressure on the gallbladder walls, it can result in referred pain that radiates up to the shoulder or the shoulder neck region. Consequently, the short neck muscles, some of which are merely as thick as a pencil, become a source of trouble. These slender muscles, situated right in this area, are capable of causing intense pain. Moreover, one of the primary symptoms that emerge is fatigue. Fatigue that is associated with the liver is, in essence, the definitive early warning indicator. It may be due to alterations in blood sugar metabolism or fat metabolism, which can cause blood sugar levels to drop or in some cases rise, though it is more commonly a decrease. This condition then leads to the aforementioned debilitating fatigue. Consider the phenomenon commonly referred to as soup coma, which occurs when one has consumed an excessive amount of food or feels lethargic after eating. This is often attributed to the body's need to first absorb all the ingested nutrients. For instance, if the meal contained an excess of sugar, it must be shuttled through the portal vein to the liver for further processing, and frequently the so-called soup coma is merely a manifestation of the liver being overwhelmed. Alternatively, it could be a case of hypoglycemia, particularly if the meal was overly rich in sugar and carbohydrates. Then, following a span of roughly 30 to 45 minutes, due to the body's insulin response, the blood sugar level may plummet into hypoglycemia. Indeed, this scenario is also a possibility. Should you have a liver problem, possibly stemming from the Epstein-Barr virus, which significantly impacts the spleen, lymph nodes, and liver, it's a prevalent indication that individuals with chronic Epstein-Barr virus infection especially suffer from pronounced fatigue. What can you do now if you've realized, oh no, I have early signs of liver issues? Definitely go to the doctor. Why? The doctor needs to conduct a lab test, take a look at your liver values, palpate your liver and gallbladder, take a medical history, ask you questions, and fourthly, very, very importantly, perform an ultrasound to check if the liver or gallbladder is enlarged. Are there any drainage problems? Are there gallstones? Is there biliary sludge? That's what we call it when the bile ducts are clogged not by stones, but by a mushy pudding-like bile secretion. So that's the diagnostic process. And what can you do therapeutically? Changing your diet is a smart move. Don't irritate the liver and gallbladder with too much fat or protein. For instance, a vegetarian whole grain diet can be very beneficial. Then, of course, a major point is to avoid toxins in everyday life. If you've had amalgam fillings, consider getting a heavy metal test, for example. It's well understood that heavy metals can severely disrupt the detoxification processes of the liver. Therefore, it's crucial to avoid substances like glyphosate, preservatives, and similar compounds. To actively support your liver, you can turn to glutathione. This is a compound naturally produced by the liver to cleanse both itself and the rest of the body. We frequently observe a significant imbalance between what is known as reduced glutathione and oxidized glutathione. I often describe it to my patients in simple terms. They need a surplus of empty wheelbarrows compared to what their bodily workers can manage to fill. This ensures they're protected because whenever a toxin is generated, there's always an empty wheelbarrow ready to transport the toxin away for elimination, illustrating the critical balance between reduced and oxidized glutathione. These are substances that can be very effectively added through dietary supplements to enhance the body's natural detoxification capabilities. At the beginning, I mentioned traditional Chinese medicine, and the Chinese 2,000 to 3,000 years ago observed very closely what it means when someone suffers from liver and gallbladder issues. You can see here at the top of the head the gallbladder meridian, which is often involved when the liver is not functioning well. This can lead to typical headaches, migraines on the side of the head, often extending over the shoulder and neck area. And very frequently right up here at the front, where the gallbladder meridian, barely visible, ends above the eye, here this green line, that's where we often find a point of pain. A bug crawls across the liver, as I wanted to say. The Chinese have recognized the connection between the liver-gallbladder system and, for example, anger. And you often see that people who have problems in the liver gallbladder area tend to have choleric outbursts. They throw plates and words around. But, and here's the good news, they're not at all resentful. That means a person with a weak liver gallbladder system might explode, vent their mood, and then they feel better. If you find yourself dealing with such individuals, I simply wish to convey to you, allow this, which the Chinese term liver wind, to just drift away. These individuals do not take things to heart. They harbor no resentment, in stark contrast to those who possess a fragile disposition, akin to having a weak stomach.
Und
It's simply that, imagine, these individuals are brimming with vitality, they act on impulse, they're swift, they shift focus rapidly, and regrettably they often become irritated with themselves and frequently show that irritation. But frequently it happens, and perhaps you're among them, that if you merely suppress your anger, it persists. If you don't show your anger, then you're a bit of a liver weakling. So if you go to sleep with anger, for instance, you wake up the next morning, the birds are chirping, it's a beautiful spring day, you feel good for 2 minutes, then you remember yesterday's anger and whoosh, your mood is right back to where it was yesterday, then you're a liver gallbladder weakling. And I want to let you in on a little secret about what you're missing. That's courage. I mean, if you have the guts to talk about what's ticking you off with the people around you, then you can diffuse that liver-loving gust of anger. I'm looking forward to you watching the next video. I'd be thrilled if you subscribe to the channel, and then take care. Until the next video, see you soon.